try and just cover a little bit of background information and set up some questions so that Dr. Wong can talk about what we've been working on in the lab, which is working towards immunotherapies. And one of the areas that people have been talking about forever are cancer vaccines and what is their potential for mesothelioma.
Particularly looking at the comparison of 3D conformal techniques and comparing those patients and how they did compared to the patient who recently had tomotherapy. A lot of stuff I think people have gone through, and in the interest of time, I can go through them pretty fast. I have no disclosure.
Thank you very much for inviting me here. It is a challenge to talk about systemic therapy in mesothelioma. We don't have that many options, but we will try to go through the latest things that are available, and specifically we will go through the immune therapy. The tumors that were induced in mice by carcinogen could be controlled by the immune system. And what we saw is that suppressing the activity of the immune system allowed dormant tumors to escape from the control of the immune system and start dividing, disseminating, and eventually cause death of the host.
But also we know in patients, if you can't get a 95% debulking, like a half debulking like this is actually worse than not operating. And I think it's because of, the immune system suppressed, and cancer loves all those factors that are coming in to heal the surgery. So that was our hypothesis anyways.
So I was telling a few of my colleagues yesterday, some of my referring colleagues, that I was going to come out and talk about the flavors of radiation, and they kind of rolled their eyes, and they said, that doesn't sound very exciting, and it reminded me of a story. So I grew up in Texas, and so I'm a big fan of Lyndon Baines Johnson, and so there's a story of LBJ, and he was talking to a healthcare economist. The healthcare economist was going on and on about all the great things that were happening in, his world, and why this was so amazing that, when Medicare and Medicaid were coming out back 50 years ago, and LBJ just kind of stood there and listened to him for about 10, 15 minutes, drone on and on and on. And so the healthcare economist at the end of it says, well, you're not saying anything. What do you think about this? And so LBJ kind of turned to him very sternly and very quietly and said, everything you've said is kind of like pissing on your leg. And the healthcare economist was kind of like shocked. And he was like, this is the president of the United States talking about pissing on your leg. And so he said, LBJ responded, he's like, it's really hot to you, but not to anybody else. So hopefully this conversation that I have with you is actually going to be inspiring and hot, because I do think the radiation therapy has some really exciting things that we can kind of talk about.
I was in the pioneering time of lung transplantation. I was at Washington University, worked with Joel Cooper, but I did not train at the Memorial Sloan Kettering Cancer Center. I was a visiting professor and spending some time in this stage. Recently, I was additionally also a visiting professor at Harvard. David Sugarbaker invited me there. What is absolutely correct, when I started and went into mesothelioma research and treatment, we had still this belief that the disease of mesothelioma is unaffected by current therapeutic maneuvers. This was stated in 1988, but even in the year 2000, this was a kind of the opinion. And I thought this was unacceptable, and started a program in 2000, which was neoadjuvant chemotherapy, followed by EPP and variably radiotherapy.
I want to talk about the human cost of inaction, because I think after an afternoon of hearing about all these wonderful clinical trials and what's happening in the medical field, it's also important to know some of the things that aren't spoken about, not necessarily in this room, but when you read articles and you look at studies to see what is exactly going on behind the curtain. Most importantly, though, before I begin, I always dedicate every keynote presentation to a victim, but today is different. I'm going to dedicate it to 3 victims who paid the ultimate price for a hug from a parent. It was a deadly hug. Michael on the top left lost his battle at 29. Janelle on the right at 39, and Debbie at 54. Again, staggering. And as Dr. Irving Zelikoff said it best, statistics are people with the tears wiped away. And for all of the doctors who treat the patients, and all of you here today, you know exactly what that means.
We try to get people to address a lot of different issues in this disease, and again, this is a very small orphan disease, and we're trying to rush a lot of things through in a small period of time, but we really appreciate everybody coming out to support this. Thanks to all the speakers, particularly the ones that came from a distance, and of course, thanks to our sponsors. It's without the sponsors, we would not be able to have this. As you see, the food and everything that's available in the room and everything costs way more than the registration fees even cover. So we owe everything to our sponsors, and thank you for our special guests, Mia Lauder and Linda Reinstein, for making this a very special day. Any other comments or questions? Otherwise, we'll see you next year. Thank you.